China is taking a big step to tackle pneumonia of an unknown origin. Now, the country's disease control authority is testing a new monitoring system aimed at detecting and managing unknown pathogens. Now, this system comes as respiratory diseases like rhinovirus and human metapneumovirus show a rising trend, particularly among children under the age of 14 in the northern provinces. Data from last week indicates a general increase in respiratory infections, although officials say that overall numbers this year are expected to be lower than last year. Now, the new procedure will require labs to report cases promptly and allow disease control agencies to verify and respond quickly. Meanwhile, respiratory experts are warning the public not to blindly rely on antiviral drugs to treat human metapneumovirus, as there is currently no vaccine for it. The virus causes symptoms similar to a cold but can lead to serious complications if mismanaged. Now, with winter in full swing, health officials are calling for greater vigilance and early medical attention to reduce risks from respiratory illnesses. Dr. Veer Pushpak Gupta, physician and researcher at NHS UK and founder and CEO of London Global Health, joins me live on Pulse right here, joining me from London. Dr. Gupta, thank you so much for joining me. It was exactly 5 years ago, around this time of winter, and cold-like symptoms were claiming lives in China. As of now, it's 2024. How concerned should one be with this unknown pneumonia?
Yes, thank you for having me on the show, Shivan. And you're absolutely right. It was 5 years ago, around this time, December 2019, where the COVID pandemic started from China. And we were obviously hit by it very badly all around the world. More than 1 million people lost their lives. We should be concerned, but I don't think we need to be concerned at the same level as that. Every year during this time of the year, respiratory viruses get spread around the populations all around the world. In the UK, we have a surge of respiratory viruses during this time of the year, mainly because people are indoors. There's lower immunity due to the cold weather, and influenza and airborne viruses are spread in these conditions quite easily. So shouldn't be too alarmed, not to be alarmed at the same level as that was in 2019. But of course, the news coming out of China is important, and we need to keep an eye on it because China has always been a hotbed for such viruses. And once they spread from China, they spread globally quite fast. So this news that you've just mentioned about their CDC being alarmed about the metapneumovirus and keeping track of the new viruses that are coming out is nothing new, by the way. Most agencies around the world do it. We have the UK Health Security Agency in the United Kingdom that monitors viruses around this time of the year and yearly through doing RT-PCR on random populations and monitoring how fast and how easily these viruses are spread. We've got the CDC in the United States. We've got the Indians have the ICMR in India, which is the Indian Center of Medical Research. And so China has got this agency that does it as well. So this is nothing new, but it is good that they're keeping an eye on the viruses that are emerging in China.
Dr. Gupta, the new pathogen monitoring system, you mentioned it briefly. What is China really doing which is new over here? As you mentioned, it's nothing new as far as the monitoring is concerned, but for China, they're calling it a new monitoring system. Anything that you've picked up on what they're doing? There's little news that comes out of China, but anything that you can add to it?
Yeah, as you said, little news comes out of China. We don't really know what kind of new technology they might be employing, but the general way of doing this is to do RT-PCR tests on, as I said, on the random population to see what kind of viruses are spreading in the general population. This is what the UK does. This is what the CDC in the United States do, and then to see whether there's an increase in a particular type of virus. They also keep an eye on the mutations that are happening in these different viruses to see if there's any new mutations that we need to be worried about. Remember, these pathogens are there in society. They're there in the air. They're there in our world. But it's just an increase in the amount transmission from wildlife to humans, mutations, and also sort of spread in particular populations. Like you mentioned, metapneumovirus, it's usually spread in children, in a younger population. So these are the things that agencies keep an eye on to see whether anything is changing from the norm. rhinoviruses, coronaviruses, influenza viruses. These are the viruses that they keep an eye on because these are the fastest spreading viruses in humans. The bird flu, for example, as well is another case. So these are the things that these agencies keep an eye on. China, in particular, is interesting because China has such a dense population living very close to each other. They also have a lot of contact to they have a lot of wildlife which is mixing with human population, and also the wet markets of China, which have now been banned ever since the coronavirus, where wildlife was being sold for human consumption and otherwise it has now been banned. But these practices are still going on in China, and that's why it makes it so important to keep an eye on spread of these viruses over there.
Any pathogens stemming from China? Any news of that kind making headlines anywhere? It's always unsettling after, especially what we've gone through over the last 5 years. But here's hoping that this is not, as much a cause of concern as has been in the past. Thank you so much for joining me, Dr. Veer Pushpak Gupta from London.